Everybody. So in this video, we're going to talk about some of the reasons why the arterial blood pressure would increase. So what are the things that are causing that to happen? The first one is a nice and simple one that we already talked about, and I used that balloon as an example, right? So if I have a water balloon, whenever you put water in a balloon, there's going to be pressure being pushed on the inside of the balloon, right? So if that's the case, what happens if we just add more water to my water balloon? It gets bigger, and therefore there's more pressure. How do you know this? Because if you ever used a water balloon before, you know that the more water you put in it, the more likely it is to pop, right? There's too much pressure building up on the inside. Same thing with blood volume. If you increase the blood volume inside of your vein or artery, so here's my artery, right? If I increase the amount of liquid inside here, that's going to increase the amount of pressure on the arterial walls, and therefore blood pressure goes up. Heart rate, if you increase your heart rate, that'll also increase your blood pressure. Stroke volume, same thing. So again, stroke volume relates to how much blood is being pushed out of the heart per beat. So again, if you add more blood to the heart, you're going to push more blood into the arteries, just like we were talking about over here, right? Same idea, it's going to push more. So therefore, if you're pushing more blood, you're going to have more of a pressure that builds up. Blood viscosity, so how thick your blood is. So if you have a thicker blood, you're going to increase your blood pressure. So that's another thing to keep in mind. So thicker blood is a higher blood pressure. And then this kind of sounds like the same thing, but it's really the opposite. So again, if we have our blood vessel here, we could do one of two things. Increase the amount of blood on the inside of it. That'll increase the blood pressure. Or we can increase the peripheral resistance, in other words, the outside of the blood vessel. So the blood vessel itself, if we push in on the blood vessel, that'll increase the pressure as well. Same thing as the water balloon, right? So if I have a water balloon, it has water in it, it has pressure, right? Option one, I fill up the water balloon more. That creates more pressure. Option two, what if I just squeeze the water balloon, right? If I start squeezing from the outside, that can increase pressure too, right? That can increase its ability to want to pop. How do we do this? Typically, the most common thing is you're going to take your artery and constrict it, right? So, blood vessel constriction will do that. So, the blood vessel walls are going to push in and constrict, therefore, making it a smaller passage. Another example of this, again, is like the hose example. If you have a hose and you're spraying your hose around, like your yard and your garden, if you put your finger over the top of the hose, you make the hole smaller, right? So let's say this is the hole. If you make it even smaller, like you cut it in half, now the same amount of liquid is going to try to escape. Therefore, it sprays more, right? So you can spray the water around. That's the same idea as what we're seeing here with the peripheral resistance. If you constrict the blood vessels, it's going to increase the pressure. Where do you feel these arteries, right? So how can you feel your pulse, right? So the arteries you can feel all throughout your body. And the most typical ones you hear of are the radial pulse, the one on your wrist. Why is it called radial? Again, the bone, the radius. The brachial, you can also feel the brachial pulse. There's some facial ones, the carotid artery, your temporal, your temple, the tibial pulse. So there's a lot here. Popliteal, back of the knee, so femoral. There's a lot of places where you can feel your pulse in your body. And again, it's all comes from the same thing. Your heart's pushing blood through the arteries, and it has so much force that you can feel the push from your heart all the way, all throughout all of these different arteries. How do you measure blood pressure? We will talk about this in lab, but generally speaking, you're going to use a blood pressure cuff, right? And the idea is you're going to measure the systolic pressure and the diastolic pressure. So, in other words, long story short, you're going to fill up this balloon on your arm. Again, I'll use all the proper terminology in lab, but generally speaking, you're going to fill up this balloon, and the job of the balloon is to basically, it's literally to cut off your blood supply, right? So, you have this artery that's delivering blood. So, blood's trying to pass through the artery. And what you're doing is you're cutting off the circulation. Then you begin to measure. You're going to allow for this gauge to decrease, right? And as it decreases, you're listening. You're listening and waiting to see what happens. And eventually, you're going to get to a pressure that's high enough, the systolic pressure, the highest pressure needed to push the blood through the veins and or through the artery. And then you're going to start to see the flow, the circulation continue. So it's going to begin again. And you're going to start hearing the thuds of the heart. And that's your systolic number. Then you're going to continue to listen and listen until eventually you can no longer hear the heart. And that is going to be your diastolic volume. Right? And what are the average ones you're going to see? For systolic, it's about 120. And then diastolic, it's around 80. That's why we get a blood pressure of 120 over 80, generally speaking. If we look at this chart, you can see it, right? So going all the way to the aorta first, so the first major artery, you're going to have systolic pressures, this higher number. The higher number is it's going to be higher because, again, that is the systolic pressure. Systolic, like we talked about, is the actual contraction. So the heart contracting. So it's going to be a higher number. So generally you see 120. The diastolic you can still measure, and this is when it's resting. Okay, and why do I keep using that water balloon example? Because if you have a water balloon and you squeeze it, right, the pressure is going to go up because you're squeezing a water balloon, right? The point is, when you stop squeezing it and it's relaxed, there's still pressure inside the water balloon, right? So it's not like it goes back to zero, right? That balloon still has pressure because of the water inside it. Same thing with your arteries. There's still blood inside the arteries that have pressure, and that's your diastolic volume. So that's the lower one. So you have a pressure, the higher pressure where you're squeezing, and the lower pressure where you're no longer squeezing. As it continues, you start to notice throughout your arteries. So the larger arteries, these numbers start to decrease because the arteries are getting smaller and they're further away from the heart. And as you go, those numbers continue to drop. They're still pretty high, but they continue to drop. When you get to the capillaries, it really starts to drop a lot. When you get to the venules in the smaller veins, it drops essentially to zero. So now there's almost no circulation from pressure alone, and you need outside forces to help you. And this is where your skeletal muscles will help squeeze the blood, and this is why you have those valves in your veins. If you have any questions, please let me know.